my first question to you, what are different type of diabetes and what are the early symptoms of it?
So mainly diabetes are of two types. There are many other types, but the most common ones are type 2 diabetes and type 1 diabetes. So out of 100 people, 90 have type 2 and approximately 8 to 9 people would have type 1 diabetes. The 1 out of 100 would have other kinds of diabetes. For example, there is something called MODY, which is a genetic kind of diabetes, and mitochondrial diabetes. And there's a special kind of diabetes which we see in countries like India. It's called tropical pancreatitis. So fibrocalcific pancreatitis and diabetes, in which pancreas has some fibrosis and calcification and diabetes. So for all practical purposes, we should know about type 2 diabetes and type 1 diabetes. Type 2 diabetes is a slowly progressive diabetes. In early stages and up to a quite late stage of diabetes, there are hardly any symptoms. So 80% of people with type 2 diabetes will not feel anything. So which means that we will know about the disease only when it's very advanced. So therefore it is recommended that we should screen for it, which means that we should actively go and check for the blood glucose and not wait for the symptoms to come. Whereas type 1 diabetes presents dramatically with symptoms which are mostly because of very high blood glucose and glucose loss in the urine. So it happens in younger population, kids, young adults who present with weight loss, going to the loo frequently, like frequent urination, excessive thirst, excessive hunger, and if not treated, then there are symptoms of ketoacidosis, which is an acute complication of type 1 diabetes, in which there may be abnormal breathing, breathlessness, kids complain that they're not feeling comfortable, abdominal pain, vomitings. So these are symptoms of type 1 diabetes, and because it happens in younger age, people do not suspect. For kids, people don't keep that suspicion open that even kids can have diabetes. So it is important to be aware of these symptoms. If any of these symptoms are present, do check for glucose. Weight loss unexplained, excessive urination, excessive thirst, excessive hunger. But in adults, don't wait for symptoms. Just go and check glucose.